Good morning, good afternoon, good evening, wherever you may be. This is Firoz Manji from Daraja Press. Thank you for joining us here on Organizing in the Time of COVID-19. Today, I have a most interesting guest. Kavita Krishnan is Secretary of the All India Progressive Women's Association. She is also a member of the politburo of the Communist Party of India and editor of its monthly publication, Liberation. Uh, Kavita is also an author and has published a book called Fearless Freedom, published by Penguin in India. Just to give you an idea of what that book is about, it's described as safety for women in India is more often than not coded as curtailment of autonomy. To be safe, women are told they must allow themselves to be kept under constant surveillance. Their movement is restricted to specific spaces, often homes and hostels. Extreme levels of control are exercised to confine their mobility. But is freedom really incompatible with safety? Asks Kavita. She locates the personal and the political repercussions of erasing women from the public spaces. She argues that many real and violent threats to female autonomy are in fact hidden in plain sight. This is an extraordinary book, and I'm really pleased to have Kavita join us today and to discuss what a democratic approach to the pandemic would look like. Kavita, a warm welcome to you. Thank you for joining us today.
Thank you, Firoz. It's a privilege. I'm so glad to be here. Yes.
It's great. Kavita, we've done a lot of interviews with people around the world, and what we're hearing, okay, is government after government are basically proposing a sort of standard formula of how to deal with a pandemic. You know, it's uh, telling people who live in slums to wash their hands when they have no water, to ask them to use soap when they have no money to buy it, and they exercise social distancing, so-called physical distancing, when they live in crowded slums, crowded settlements, and it just seems to be impractical in that sense. Um, I'm not sure so much about India, but in much of Africa, the disease has been brought in by middle class travelers who come from elsewhere, from Europe or from America, and bring the disease with them. Instead of focusing on them, what we see in many countries in Africa is the militarization of the streets and, in some cases, even the implementation of a curfew, as if the virus doesn't propagate during the night. Uh, there is an urgent need, I think, for a discussion to open up as to what a democratic approach to the pandemic might look like. So, Kavita, help us grasp with this.
Yeah, actually, right from the beginning, I've been grappling with this and trying to think about uh, how to separate the idea of a state response to this from from what a people's response or a democratic response could look like. Because I think that what has happened, what I see happening a lot, is that on the left, especially in India, I'm not talking about party left and so on, but just among people who are of a left-minded uh, thought, what happens is that because they are uneasy with the government's coercive lockdown and so on, what they tend to do is to go into a mode of COVID-19 denial, of saying that, oh, the disease must be fake and this must be hyped up, and it must not be worse than the seasonal flu. And look, in India, you have so many other worse diseases. And so, in the questioning of the government's approach to this disease and to the crisis it represents to the world as we know it, there is an attempt to deny the crisis itself and to say that, look, this is all fake. this is all made up. And in that, they end up occupying space. They're sharing space with the sort of pro-Trump, far-right kind of propagandists, COVID-19 denial propagandists in the US, and so on. Okay. So I think that right from the beginning, we've been trying to say that, look, that isn't the way to go. The way to go is not to deny reality, not to deny the fact that COVID-19 today and perhaps some other similar contagious disease tomorrow, just as you have had in the past as well. These are things that make you rethink the way in which your society is structured. COVID-19 presents the crisis that it does, not just because it is an objective natural disaster, but precisely because of the way our society is structured, how that makes it difficult for even the richest country in the world to be able to protect its people from a contagious disease. This is the situation you're faced in. So it's making everybody in every country in the world sort of try and rethink. So then, how, if we accept that COVID-19 is a real threat, it's a contagious disease that spreads especially fast and that can be fatal for those who are otherwise vulnerable, either because they are elderly or because they have suppressed immunity or because they are, they have respiratory illnesses or other comorbidities and so on. How do you have what do you mean when you say democratic response? I feel that what we mean when we say democratic response is that it should be a response that people choose, that people are on board with, are not out of fear, not out of hatred, but out of a sense that we are in this together. And it is a response that is committed to ensuring that no one, and especially the most vulnerable economically, socially, health-wise, all those things, are actually taken care of. And that response is something that is not just for the COVID-19 period, but for the future as well, for a post-COVID-19 world as well. So I think what has marked the state response to this from the China, from China onwards, basically China came up with this method of the lockdown, which is basically a state-led, coercive kind of top-down lockdown, right? And I think that from there now, that is the model which most countries in the world have adopted, and which in many places is basically sharing space with, as you said, with a curfew or with a totalitarian kind of crackdown or clampdown on freedom of expression. So not just on freedom of movement to prevent the spread of the virus, but actually, so even the UN has had to make noises about this, to talk about this and say that this is not what should be happening. You shouldn't be curtailing civil liberties and so on, right? But that has marked the response. And why is that? Because I think that the idea is that during an emergency of the kind that COVID-19 represents, the idea is that the idea in capitalism is that the minute there is an emergency situation, you have to jettison democracy. The jettison, if you're if you're in a ship and the ship comes to stormy waters, democracy becomes the first thing that you throw overboard, because that is the thing that you think of as being too heavy. That's going to bring you down, and so you need to chuck that out of the way first. However, it's a democracy is a luxury. It's not. It's for times when we're not in an emergency. Okay, when people's lives are not at stake. And that is where I think is the fundamental, primary, really big mistake, because no, that's not how things work. And when I was trying to think about this, I went to something that is not a political resource so much as the writings of a doctor. And if I have time, I'd like to just briefly mention that and kind of read out from it. Can I do that?
Of course.
So this is Atul Gawande's book. He's a surgeon and a writer, prolific writer on medical issues primarily, and an extremely readable writer. So this is a book of his called Better. And the first chapter in that book actually is about infections, about hospital borne infections, which, people come to hospital with some other problem. They're admitted in hospitals, but in the hospital they contract some other infection, which can even be fatal. And so hospitals generally, keep on worrying about this problem of how to reduce the hospital-borne infections. And hand washing is a big deal there, because it's something as simple as hand washing, which we all know about now because of COVID-19, that if doctors and health personnel wash their hands, then they would not be transferring diseases from one patient to another, and they would not be spreading hospital-borne infections. That is basically what the chapter is about. So he talks about how hospitals grapple with this and how basically they don't succeed. But he talks about one particular success story and what we can learn from that. So he talks about one surgeon who came across an article about a Save the Children program to reduce malnutrition in Vietnam. The story seemed to Lloyd, who is the surgeon in question, to have a lesson for his hospital in Pittsburgh. The anti-starvation program run by Tufts University nutritionist Jerry Sternin and his wife Monique had given up on bringing outside solutions to villages with malnourished children, because that strategy had failed over and over. So basically, although everybody seemed to know what to do to fight malnutrition, but basically, am I audible? Am I still with you?
You're audible, but I think your camera has gone sideways.
Okay, how do I do that? Let me just see whether. Okay, no.
Yeah, okay, I think.
Okay, I think that's all
Sorry
right.
about
Yes.
that. Yeah.
No,
okay,
no, it's
continue.
okay. No, it's not because of you. It's some
Remind
call.
me the book. Remind me, what's the name of the book?
It's called Better. It's just Better, and it's by Atul Gawande, Gawande. He is a US-based surgeon, and he has written a series of books. Mm-hmm. And so in this book, he talks about, he says basically that this surgeon came across this write-up where he found that, where everyone knows how to solve malnutrition. The experts know. But local communities don't want to change such fundamental matters as what they feed their children and when, just because some outsiders say so. And so this couple focused on finding solution from inside. So they would talk to groups of villagers to identify who among them had the best nourished children, and then to visit those households, talk to those people in those households, and try and figure out what are you doing that is a positive deviance, that is somewhat different. What can we learn from that? And that was pretty revolutionary and worked extremely well. So they try the same thing in the hospital. So basically what they do is that they held a series of 30-minute small group discussions with healthcare workers at every level: food service workers, janitors, nurses, doctors, patients themselves. And the team began each meeting saying, okay, here's the problem of hospital infections, and we want to know from you. You're the expert here. You tell us how to solve it. No directives, no charts, and the only dictum was, thou shalt not try to fix anything. And ideas came pouring out because all these sections of people said, nobody asked us before this. And then they would say, oh, where are hand gel dispensers missing? How to keep gowns and gloves from running out of supply? And nurses seem to always be able to wash their hands and taught by patients to do so, but doctors wouldn't do it, and all of this. So basically, this led to a shift in norms and a democratization where staff members and nurses took matters in their own hands. And nurses who would never speak up when a doctor failed to wash his or her hands began to do so after learning of other nurses who did. When hand gel dispensers arrived, staff members would decide where to put them. And therapists who thought wearing gloves with patients was silly were persuaded by two of their colleagues that no, it was important to do so, and all of this. So while the ideas were not really new, there was nothing groundbreaking, but there was something about the fact that people themselves were involved, and that people who otherwise are not seen as experts, are not seen as people with power, actually had solutions that worked. And so how do we think about this in the context of COVID-19? And that, I think, is the big issue here, that physical distancing so as to prevent the spread of the virus and various other precautions are important. But the point is, they are important because you have to learn to make them available to everybody. As you said, if people are crowded into into slums, physical distancing is going to sound like a joke to them. You can't just tell them, oh, have physical distancing. What is going to be the solution there? So in a country like India, it's interesting because the Indian Council of Medical Research, which is called ICMR, we now know in India there's no transparency where governance is concerned, and so the government has basically hidden the recommendations which was made to them by their own team of medical experts and epidemiologists. And it's now a set of reporters, and I'd recommend that people read these reports. They are there on a website called Article 14, which is basically the fundamental article of India's constitution. And there is a group called the Reporters Collective, which is also there on Twitter, which has come up with this series of uh, investigative studies. And so they basically exposed this report by the ICMR doctors, who had said pretty early on that, look, you can only buy time with a lockdown in a country like India. You cannot solve the problem with a lockdown, probably in any country, but certainly not in a country of India's size and the nature of its demographic. So you can't possibly, the lockdown is not a solution to the virus in any way. So what was the solution? They recognized very early on, anybody who knows anything about public health in India knows that you can't expect, lockdown is going to force people in poor communities to spread the virus among themselves. You are not going to really be able to help to prevent the spread of the virus through a lockdown. It's very obvious. Not only that, if people are going to be out of work and there's going to be immense social and economic distress, people are then going to gather in crowds to get basic things like food. People are going to line up in queues to get food. People are going to line up, try and walk home, as migrant workers have been trying to do in India from the cities where they've come to work and where they no longer have work. And as a result, they're going to be even more exposed to, more vulnerable to the virus than otherwise. So what is it that the doctors recommended? And I should say here that these doctors are not lefty folk. Okay, they are not particularly, the people we associate with being very revolutionary or leftist or anything like that. Okay, so what these people, what they do understand the Indian public health scene. No noise there, please. So they do understand
it's part of life.
Okay. yeah. No, I was just trying to tell them that I'm on this. Yeah. So so the thing is that what can we do that is what that these doctors said in a place like India. They said that in fact you may use a lockdown for a very short period, but they said that essentially what you need to do is have a community-led response rather than a top-down coercive lockdown. They said this in no uncertain words. They said that the China model of a coercive lockdown would be a particularly bad idea in India. And they explained why. They said that what is bound to happen is that this will create a sense of fear and stigma around the virus, which will push it further underground. People in India, poor in India, in any case, do not seek medical help very fast. And in this case, this will deter them from seeking medical help even more. And so you won't know who has the virus and who doesn't until it is way too late. And so they basically said that what you should have is a community-led, civil society-led approach where you basically build trust in communities. You encourage people to go about their normal lives. And you tell them that, look, the best we can do is to try and identify symptomatic people. So you basically encourage people, create a safe place where they feel free to come and report symptoms, where they feel able to say that, look, a lot of us have a cold, we have fever here. And then you try and isolate the symptomatic people within at least 2 days or even 4 days of their developing symptoms, and we would be doing pretty well, is what these doctors said. Instead, and this clearly meant that you had to have a radically different approach from what the government has adopted in India, which I'll explain in a minute. But clearly, this meant that you had to create trust. You had to have communities understand what the symptoms mean, that the symptoms are not a signal to shun the person, but to take certain precautions and to do either home quarantine, or if that is not possible, then to create places where they can be quarantined, comfortably and safely, where the symptomatic persons can be quarantined. And then you kind of surveil the communities themselves sort of keep a watch on their own selves to see whether there is appears to be a spread and so on. So this is what the doctors recommended. Instead, what the government did was this top-down lockdown that we've now had. We are in the third phase of that. And also, they did a whole propaganda around treating COVID-19 patients, describing them as corona bombs and so on. This is not the language of government exactly, but it was the language of uh, members of parliament, members of legislative assembly, leaders, political leaders of the ruling party, and of course, media that is very, very television media that is very close to the government and that is a propagandist for the ruling party, which is a Hindu majoritarian party. And it didn't it didn't help matters that the first cluster that was discovered was related with a Muslim organization that had held a large international gathering in Delhi in mid-March. They had been allowed to do so by the government, so they had not been asked not to do so, and they held it. And of course, there was a lot of spread on account of that particular gathering. But that was a cue to the rulers in the government, as well as in the ruling parties, as well as among media, to make this out to be a Muslim problem. So basically, as a trigger for Islamophobia. And so they went on saying that these are corona jihadis, these are corona bomb, and so on and so forth. And this meant that the stigma around COVID-19 developed even further. It exacerbated the untouchability that is already deep hardwired in Indian society. And as a result, you had a situation where people would get angry, communities would get angry if doctors or health workers would be coming amongst them to check for symptoms. The response would be, how dare you suggest that we are dirty enough to have COVID-19? Don't you dare suggest, how dare you suggest that somebody from my household needs to be taken away for quarantine? That's only those dirty Muslims who do that. And forgive my language, but I'm saying that this was the kind of response that was orchestrated by and encouraged by persons in media, who would refer to hotspots, corona hotspots, in terms of religious organizations. So and so mosque hotspot. So the state of Uttar Pradesh would name the hotspots where coronavirus has been found by the nearest mosque. So it would have a Muslim sounding name. And media organizations played along, and they did similar news stories and all of that. It's been a really toxic, vicious mess. And as a result, it's not just Muslims who've been reluctant to come forward, but people of any community, because now they think that to be diagnosed with COVID-19 or even be suspected of it is to be a criminal, is to be a pariah, it's to be an untouchable. And you don't want to bring that on yourself, your family, or your community. So if someone has died of COVID-19, then their family, instead of following the recommendations about the disposal of the body and the funeral and so on, they would tend to try and hide it and hold a funeral as they normally would without telling anyone this shameful fact, which is that this person died of COVID-19. Because shame and stigma were associated with it, you ended up spreading it all the more because people felt, ashamed of saying that this has happened. So this is the situation we are in India right now. There have been lynchings and vigilantism around COVID-19, where somebody suspected of COVID-19 going out on the streets could get beaten to death by the police. They could get beaten to death by a mob. And, I can say this from somewhere not far from where I live. In fact, where I lived till last year. A friend of mine who still lives there told me that in that locality, which is also a very crowded, very dense area, somebody was suspected of, somebody had fever and so on, and they called an ambulance. The ambulance didn't arrive for hours. But in the meantime, people in the local area, instead of feeling empathy and sympathy and wondering what they can do to help a neighbor who may be sick, they moved around with big sticks and iron rods in their hands, saying, if anybody with COVID-19 shows up, we're going to beat the pulp out of them, basically. This is the kind of thing. And then you've had the untouchability response also, which is from the playbook of India's caste system, which means that you do social boycotts. You say, I won't buy. So you've had leaders of the ruling party, the ruling Hindu majoritarian parties, openly say that please don't buy anything from Muslim street vendors, Muslim vegetable vendors, boycott them. And this has been happening even in India's capital city. And you've also had social boycotts of doctors and health workers, as well as of COVID-19 patients or suspected COVID-19 cases. And so doctors who have died of COVID-19, their funerals have been attacked, their cremations or their burials have been attacked by mobs who have tried to say that, oh, we don't want the body disposed of in our area because that will spread. And they don't realize that by coming out in a crowd to stone the funeral party, the ambulance and so on, it is a crowd which is actually going to end up spreading the virus, not the doctor's dead body, which deserves dignity, right? So I just put all this out there. There are other instances, for instance, the situation in which you put migrant workers. If they're without food, they're having to crowd out there and, like a bunch of, even apes would deserve dignity, but you're making human beings crowd like this for one banana, grabbing at bananas that somebody is handing out to you through a gate, through a fence, right? You've had situations where migrant workers have tried to hide inside a cement mixer in order to travel back home. So it's a stripping away of human dignity, and where the migrant workers were desperate to get home, their human willingness to get home is seen as a crime, both in terms of spreading COVID-19 and also in terms of their, being a that there won't be captive labor anymore in so you've had state governments in India say, we can't allow migrant workers to travel home, we'll cancel the trains that were eventually arranged for them, because if they go, then our factories can't reopen and we have to have our factories reopen, things like that. So basically captive labor, forced labor. So instead of a democratic response, what you've had is a response that has fanned up all that is worst in society. I gave you the Indian example, but I suspect that this is a similar problem in many, many parts of the world. And unfortunately, that is the way in which our rulers tend to respond, because democracy is contagious. It's as contagious, if not more, than COVID-19. And they know that if you're going to have a democratic response to a COVID-19 crisis, people are going to learn. People are already learning, right? How to help each other, how to get food to each other, how to have empathy with each other, how to think about how the most vulnerable person on the street, their vulnerability makes everyone vulnerable. And so you need a medical system that is able to help all. These are things people are beginning to ask. If that becomes contagious, if that spreads, well, that gives people in power a lot of scares, and they don't want that to spread, which is why they are eager to spread, eager to impose a response that is state-led, that is coercive, that is divisive, and that tarnishes persons affected with COVID-19 with the brush of stigma and shame. And I think that needs change. One last point I'd like to make, just on my side, is that then what should our response look like? Your program is called Organizing in the Time of COVID-19, and what is the shape of organizing now in India as well as in other parts of the world? Organizing doesn't look the same now, does it? Because we are all isolated at home. You can't organize a protest outside on the streets. You can't organize for community kitchens the way you normally would, and all of this. It's all become extra challenging. But I think that there is still something hopeful here, because in spite of everything, we have seen in India, even in these really difficult circumstances, people reaching out to help each other. Our trade union comrades all across the country, they basically built up a response system to try and help migrant workers in distress, and then hungry communities in distress, and create a system where relief could reach them, where governments could be held accountable to bringing relief to these persons, and where they could be treated with dignity, not just as persons who somehow need to be fed. In India, you've had a huge number of lockdown related deaths, not just COVID-19 deaths. So, over 300 lockdown related deaths from things like, just let me so, deaths due to interstate travel by migrants, alcoholism related deaths, suicides due to COVID 19 panic. So, people thinking, I'm sick and so I must commit suicide before I die a terrible death, lockdown related lynchings, lockdown related hunger deaths, suicides due to livelihood issues, police brutality deaths, suicides due to police brutalities, and of course, domestic violence and deaths due to the denial of access to regular medical care for persons suffering from other problems like heart disease, like needing dialysis, kidney disease, cancer, HIV, you name it. So there's almost an embargo on other kinds of medical care right now. So all of these are a situation which should not be the case. And in the response to this, of people who have tried to create community kitchens, people who've come forward and tried to, try to provide help, I think that there is some, there's a germ of something there that we can build on for the future, that we can make better. And if we were to do this, and the way we respond now is also going to shape our response post COVID-19, then I think that some of the things we should be demanding should be basically free healthcare for all, free childcare for all, free Wi-Fi for all. Why should not all the empty homes, empty houses, empty buildings, all empty buildings be commissioned to be used as homes for human beings in need? And that this should be the case for the future as well. That we recognize that our essential workers are not our CEOs, but our sanitation workers and our grocery store workers and our delivery workers and our health workers and so on, right? And if that is the case, then why is it that even during the pandemic, we are not giving them any protection? We are having army shower petals and roses and whatnot for them in India and in other countries. But so what's the use of that? Why not ask for them to be paid a dignified wage, for them to be paid pandemic pay right now, risk pay right now, and for them to be able to, for their work to be not contractualized and insecure, but for their work to be secure, for them to be able to lead secure and dignified lives, both in the emergency times of COVID-19 as well as in normal times. Last but not least, I want to make the point that in India, there's a specific problem we are having right now, where the regime in power is basically using the lockdown as a cover to crack down on political dissenters. So they are taking this opportunity to arrest people instead of decongesting jails. They are going around arresting young activists and elderly activists who have been active in criticizing the government, questioning the government, or in protesting India's fascist citizenship, Hindu majoritarian new citizenship law. And these people are being picked up; they're being jailed. There is a pregnant woman who is in the fourth month of her pregnancy. She is in jail during the pandemic. There are elderly activists, civil libertarians, and intellectuals in India who've been picked up and jailed during the pandemic. And so this is a particularly challenging situation in India, where India's democracy, which was already under great strain, which was already crumbling, is now under strain, is now under threat, even more so during the pandemic, where the government wants to use the pandemic and the lockdown to consolidate its power for always. Yeah.
Oh, thank you. That's very, very interesting. I mean, it seems to me that what we're talking about here are the contestation between two worlds. On the one hand, you have the neo-fascist regime wishing to use the COVID situation to impose a more dictatorial, more control over the population. And on the other, what you're describing uh, is fundamentally based on an understanding that people think, that people can think, and that people can act in their own basis. They are not stupid. And I think I find it very interesting, very attractive, the way in which you pose this idea. Many of those ideas
Yeah.
which Paulo Freire wrote about in the early days, and which in India, I mean, participatory rural appraisal has been a long tradition there. But I
Yeah.
think the
Yeah.
critical issues I think that you've helped highlight are those of the necessity for respect for agency of people. That it is not just merely the state that is attacking you. It is an opportunity to build tomorrow's world today. But there are a
Yes.
couple of areas which I'd like to ask you to comment on.
Yes.
One is uh, that the origins of this virus, like SARS, like all the swine flu and so on, are fundamentally rooted in the industrial agriculture, in industrial livestock production, the removal of forest lands, the removal of people from those forest lands. Uh,
Yes.
it's tied up very much to that, and I think there's lots of literature now. We interviewed Rob Wallace recently on Big Farms Make Big Flu, and it seems to me that many of us are need to spend more time also discussing the upstream uh, aspects of
Yes.
that.
Yes.
Secondly, what's coming across in a lot of the interviews that we've made is how the the that the health services and are simply unable to afford to buy personal protective equipment and necessary ventilators and so on, um, because the price of these things has gone sky high. Why has it gone sky high? It's not because the production cost has increased. It's because of speculation on the stock exchange. The same thing is happening with food, isn't it? That there's speculation on the price of
Absolutely.
food. So why are we not discussing uh, the closure of the stock exchanges? Surely that if we want to protect people from that, does there not need to be a debate around these kind of issues?
I think certainly. And in fact, I think more than a debate, I think now if you were to ask people, quite simply, if you were to, just do what people want, in most places, people would be very quick to say that clearly an insurance based kind of health model has not worked. Government spending priorities are not clear because, you're talking about the prices of things going up. It's not just that they've gone up because of speculation. The point is that governments are basically not spending on health even now, even during the crisis. For instance, I'm giving an Indian example. Somebody's commented that it's not just India but all governments. No doubt, no doubt. As I said, I mean, I mentioned China right in the beginning and the US as well, and many countries in the world are reacting in a manner that subverts democracy rather than strengthens it. But I think that you're absolutely right that the issue, even now, about where government spending should be. If you're taking taxes from people, why are you not spending it on making sure that people can be healthy and safe, that people can have food? Why should food be something that is something which is going to be something that you can or cannot afford, depending on, why should it have fluctuating prices? Why should it not be available free for people? Why should healthcare not be available free for people? It's not that it's free. People tend to think of these things in the Indian media discourse also as a freebie. It's not free. If the government gives you the service, you have actually paid for it with your taxes. People have paid their taxes to government, and people should have a say in where that money is being spent. Today, if the government of India is spending on getting the military to do flower distribution, Why not say, couldn't you have spent that money on making sure people have enough masks? At least health workers have enough masks and enough PPE kits. They don't have that. Why can't we have more testing? Why can't we have more? Why can't we have free transport for migrant workers? Free train services for migrant workers? All these questions about where our priorities lie, absolutely. And the other thing which you said, I think, is also very important, because to understand how we got here, because these SARS type viruses are being produced by a particular capitalist system of agricultural production and industrialization, and the possibility of a spread, such contagion, is also because of the globalized world we live in, right? The nature of, and I will not say middle class and all of that, because a lot of working class also are people who are overseas, from countries like India, poorer countries, people working in richer countries, right? They also will come and go, and they also may end up spreading the disease and all of that. So it's I don't think it's okay to say that it's only privileged people who initially brought up this disease. I don't say you're saying that, but some people do, and I don't agree. But I do think that asking questions about how production is structured, that it creates such diseases, how to prevent the creation of such diseases, makes you ask fundamental questions about agricultural production, about livestock, about climate change, all of that. Yeah.
Uh, John Holloway, in an interview that we did with him a couple of weeks ago, posed the idea that unless the upstream is dealt with, the reality is people talk about extinction rebellion as something happening in the future, that in fact we are facing the first stage of an extinction of humanity. That unless we deal with the upstream, then what we have is a situation where new viruses will be propagated. Um, so what can be done in terms of your ideas of a democratic approach to pandemics? What needs to be done to prevent that happening?
Well, I think that the first thing to do is to say that, look, there's lots that we don't know. We are not doctors, we are not epidemiologists. Yes, there is much that we can't respond with ready-made solutions to many things, and I totally respect that. I think that over there, there's no debate over there. But I'm just saying that in our response to a new and challenging situation, to a crisis of such dimensions, can't we agree as people to create a political discourse that demands that you have to put the poorest and most vulnerable people at the center of your decision making right now? You have to put them center stage. So the questions of social justice and equity need to go hand in hand with those of public health. And you can't just use public health as an excuse for a curtailment of civil liberties and democracy. In this context, I'd recommend, there's something I read this morning, which I would very much recommend that everyone read, which is a piece in the Lancet by Richard Cash and Vikram Patel, called "The Art of Medicine: Has COVID-19 Subverted Global Health?" And I find that it really touches on many of the social aspects of what appears to be otherwise a medical crisis, right? We tend to think, oh, this is all medical, this is all science, and this is all some decisions that experts need to take. Absolutely, we need to respect those who have expertise. But my point is that they're telling you how the disease behaves. We have to decide how society behaves and how human beings respond and behave in the response to a particular kind of disease or a particular kind of crisis. We still have that in our hands, and we should do so by strengthening democracy, and ensuring that democracy is strengthened rather than weakened as a result of in our response to this crisis and after this crisis is past.
So, how would you describe how what are the possibilities for organizing in the time of COVID in this present situation? I know it in India. I mean, it is an incredibly difficult situation, both because of the politics of the situation, the Islamophobia that has gone on, and on top of that, the dangers of the virus itself. But it won't be us who say we should have pro-poor policies. It has to be people themselves taking that demand forward. What are the
I agree.
possibilities?
Well, one thing that we have explored here is to say that, look, although we are in a lockdown, it is not a lockdown of our minds and hearts and our questions, right? So we can exercise the right to ask questions even from wherever we are locked down. So we've tried to organize that. We've tried to, reach out to people. And interestingly, even in rural India or in urban slums and so on, people have responded to these suggestions, and they have participated in programs that are in protests, which are protests from wherever they themselves live or wherever they themselves are locked down. So they have highlighted questions of hunger. They have protested against hate speech and profiling of COVID-19 patients, so Islamophobic profiling, or otherwise, the whole untouchability, stigmatization, casteist kind of response, and all of that. So people have found ways to keep protests going and to talk to each other during a crisis like this. And above all, what we have tried to do is to focus on communities, identifying the most vulnerable among them, who are in need of hunger, who are in need of medical care, and trying to build, maintain an empathetic response in spite of everything. So that has happened. It's not impossible to do. After all, for instance, in Varanasi, which is an Indian small city, which is also the constituency of the parliamentary constituency of the Prime Minister of India. Well, Varanasi is one place where I think an amazing job has been done by people who are running a community kitchen. So they have run it in spite of all odds, in spite of lack of cooperation by an active harassment by the police. But they have insisted on saying that, look, and the police has come and tried to lock up the centers where people have collected bags of rations, bags of dry food, food supplies to give to people. But in spite of all this, they have managed to keep it going. They have managed to identify who are the most needy, the most hungry, and try and participate in ensuring that they get that they get uh, rations in order to be able to cook meals on their own, right? So have some ownership over their own lives. And I think that's very different from even from lining up for food. There's something about lining up for food which causes people to feel depressed and feel that they are not in charge of their own lives anymore, or even of what they eat, of what they get to eat. So I think providing rations and providing fuel so that people are actually able to cook their own meals and decide how to what they would like to eat and so on is still important in these times, and people are trying to do that. So I'm just suggesting these things. In India, we've had many kinds of protests. Even tomorrow, there's going to be a protest by women across the country, using social media also to highlight those protests. But it's going to be held even in rural areas, and where we are going to show solidarity with Safura Zargar, this young woman student, and who is pregnant and who is in Tihar jail, arrested on false charges under a draconian law. In particular, because, and I want to highlight this, because a leader of the ruling party who himself is accused of instigating Islamophobic violence in Delhi in February, he tweeted, and his tweet is still up there. He tweeted about this young woman saying, um, somebody said, oh, look, she's pregnant during Ramzan and she is in jail when she should be at home. And this person who is actually guilty of the violence is free and still hate mongering. So he responded to that by tweeting, "Oh, please don't connect her pregnancy with my hate speech. It doesn't work that way."
Good.
So a nasty, sick, minded kind of response by him. And his tweet is still up there, and he's still a member of the ruling party. And these are the kinds of hate speech, and sexist, misogynist speech, and Islamophobic hate speech, which is going to give him a boost within his party. So we are saying that although we are under lockdown, we are not going to take this lying down. We are going to show solidarity with that girl. We are going to tell the entire right wing social media ecosystem in India that you guys speculating about how she got pregnant during a protest and whether she's married or not, and whether this is an unmarried pregnancy or not, and whatnot, uh, is it shames you. You can't shame her like that. We are going to be with her, and we are going to really say that what you're doing, the only thing you're achieving by what you're doing, is exposing what your politics really
Yeah.
thinks of about women. So we are still protesting. We are still finding ways to organize in the midst of all this.
I know you've been doing a lot of thinking around this whole issue of what a democratic approach would be, and it's been really interesting to have your ideas put here on the program. And I hope that you are also working on putting it down in writing, because I think there's much to be discussed, and I think there'll be a lot of interest on that issue. Do you want to have any last words before we move on here?
Yeah, just the last words would be, since to repeat, I think that we shouldn't fall into the trap of thinking that a democratic response has to mean a denial of the reality of the threat of COVID-19 and so on. I can't stress this enough, that if there is let's not waste our time digging up videos by pandemic deniers and pro-Trump campaigners in the US who are COVID-19 deniers. I see too much of that happening in the left ecosystem, and I think that that should stop absolutely. We need to spend time with people. Or even if you can't physically be with people, you need to find ways, and we can do that. In if we can do it in a society like India, where technology is so weak and where phone connectivity is weak, then people can certainly do it in other countries where these things are stronger and better. And we can find ways to connect with each other. Physical distancing, but social solidarity. That should be our
Absolutely.
slogan right now.
Physical
Yeah.
distancing and social solidarity. I think that's a wonderful way to end. Kavita, thank you so much for sparing time to talk with us. And I think
Thank you,
a
Firoz. It was a pleasure.
really interesting discussion.
It's a pleasure.
And I look forward to reading what you write
Thank you.
around this. Okay. Thank you then. And go well, be safe.
You too. You too. Take good care. Take good care. Thank you.
Thank you. That was Kavita Krishnan speaking about what a democratic approach to pandemics would look like. Thank you for joining us here on Organizing in the Time of COVID. This is Firoz Manji from Daraja Press signing off. We will be back online again in about half an hour or less when we have another guest from India. So please tune in. Thanks for joining us today. Bye.